Hold on, Kat. Yep,
Okay.
recording is starting.
Okay, and then can you guys hear me and see the screen okay?
Yes.
All right, so like I said before, this is me, Kat Coleman, Alex Tone, and Nicole Castro. We're going to be talking to you guys about the human papillomavirus and its relationship to oral cancer. So the purpose of our presentation for you guys today is so that we can raise a little bit more awareness about the importance of HPV and the vaccine, specifically for people aged 11 to 26, which we'll get into more detail about later in the presentation. We're going to try to improve self-reported intent to include HPV screenings into practice protocols. So with that, we're going to be doing a pretty thorough demonstration. It's an EOIO demonstration that Alex and I recorded. So that's going to take up half of our presentation, which is the video at the end of our presentation. And then we're trying to increase your knowledge about HPV and its relationship to oral cancer. So that is the reason for the pre and post test, to get kind of our baseline answers. And then we're going to talk to you guys about what it is, its signs and symptoms, treatment, prevention, and how it relates to oral cancer.
So what is the human papillomavirus? We know it's highly contagious. We also know that it's the most commonly sexual transmitted infection. So HPV is the leading cause of oropharyngeal cancers that include the tonsils, base of the tongue, and the back of the mouth, as demonstrated in the photo there. So HPV can be difficult to detect. HPV is a virus that can stay inactive for weeks, months, or years before it presents signs or symptoms. There are several ways to prevent and treat HPV. There's a photo here that does show the percentages of what it actually causes. We're more concerned with the 25 to 35% because that's what we're going to see in our practices. So the transmissibility and risk factors of HPV. It's transmissible through skin-to-skin genital contact, most often through vaginal, anal, and oral sex. Studies have shown that males are at a higher risk than females with the ratio of 4 to 1. Risk factors can include people who have multiple unprotected sexual partners within their lifetime, and each encounter can increase the chances of contracting HPV. So how is HPV connected to oral cancer? According to the American Cancer Society, approximately 5,200 new cases are reported daily, and 1,670 Americans will die each day from cancer. Oral cancer does make up roughly 3% of the diagnosed cases annually. HPV is difficult to detect. Few of the signs and symptoms can be painless, and certain lumps and swelling can go undetected if not properly screened. And that's where we come in the dental field. We have to know what to look for. Dental professionals need to perform oral cancer screenings and advocate to parents and patients about HPV and its signs and symptoms, as well as the HPV vaccines.
So there are many signs or symptoms that can be present in the detection of HPV, and that's due to the various types of HPV that can be present in men and women. So oral HPV may not show specific symptoms, but there are numerous types of warts that can be present if the body's immune system isn't able to fight the HPV infection. So although the warts are uncommon, they can appear in the oral cavity. It just might not be as often, but the types of wart that appear depend on the strain of HPV. So you just have to look out for the different types of warts, and we included this picture so that you can kind of see what they look like, but I'm going to describe each of those a little bit. So one of the warts is genital warts, and those can be flat, small, and cauliflower-like, and they can show up on both men and women. These types of warts do not usually have irritation around the area. Another type of wart that can be present are common warts, which are usually found around the hands and fingers, and those are kind of a little more rough and raised bumps. They can be irritated more due to the area that's affected and the nature of using our hands in everyday activities. Plantar warts are more likely to appear on the heels and the balls of the feet and are much harder and grainy in appearance. They can also be more irritated for the same reason as common warts. And then the last type of warts that can be present are called flat warts. These warts are slightly raised and they can be found anywhere on the body, although typically men and children get them on their faces, while women may find them more commonly on their legs. And then if HPV has progressed to oral cancer, there are other symptoms that may show, which can be a swollen but painless tonsil. So it's important to remember that cancer does not always present with pain, so the painless tonsil is very important. Persistent sore throat, an ulcer or sore that has not begun to heal within 2 to 3 weeks, difficulty swallowing, or a painless lump on the outside of the neck that has been there for more than 2 weeks. So all of these should be getting addressed when we're doing an EO-IO and brought up with the doctor if something is discovered to find out the best way to treat and proceed with the patient. As far as prevention goes for HPV, there are methods that can be done to help inhibit the spread of HPV and its associated symptoms. So dental hygienists can reduce the spread of infection and warts by explaining to the patient not to pick at the warts, not to wear shoes in public places, not to bite their nails if any warts are present. And the spread of genital warts can be lowered by practicing safe sex using latex condoms or dental dams, or by reducing the number of sex partners. And then as far as the vaccine goes, they are approved by the Food and Drug Administration and are available to help prevent the spread of HPV. So the CDC recommends that both boys and girls between the ages of 11 and 12 receive the vaccine. It can be administered if the person is older than 11 or 12, but the research shows that it's more effective on children under the age of 15. So there are slightly different guidelines on how many doses are needed or recommended depending on the age of the person, but that would be discussed with your doctor. And it's very, very important to remember that although the vaccine is effective in reducing the number of people that can acquire HPV, there is no cure for HPV. So a lot of times HPV can clear up on its own. So the treatment is more focused on the symptoms that can be present. So if oral warts are present, they can be surgically removed, frozen off using cryotherapy and liquid nitrogen, or treated with something called interferon alpha 2B, which is an injection that would be performed by a physician. And then there's medications that can be useful in treating the warts as well. If there are precancerous cells detected, those can be removed by a physician. And if the HPV does lead to oral cancer, then that would be treated with chemotherapy, radiation therapy, surgery, or sometimes a combination of those methods. So even though many treatments can be successful for the symptoms, it's very important to practice the early prevention methods.
Hey guys, this is Alex. So what is the role of the hygienist? So a big role of the dental hygienist is to prevent disease and educate patients on the importance of prevention. So we're basically the prevention specialist and should be educating all our patients on the importance of coming in regularly to get their oral cancer screenings, educate our patients about nutrition, and also educate our patients about the HPV vaccine, which has been studied for more than 15 years and has been proven to be an effective and safe vaccine that can protect against cancers associated with the human papillomavirus. And as dental hygienists, we can also help prevent the human papillomavirus by using our motivational interviewing skills with our patients. And some ways to do this is by asking open-ended questions and making affirmations throughout the conversations that we have with our patients, which can really have a great impact on a patient's health behavior. Motivational interviewing is great because it is patient-centered and evidence-based, which can be used by hygienists to strengthen a patient's motivation for a positive change in behavior. And just to give you guys a better understanding of how motivational interviewing can be used with our patients, a good example would be in the case of a patient who doesn't like to come in regularly for dental exams. The dental hygienist can open up a conversation about the importance of visiting the dentist regularly and inform them why they would greatly benefit from periodic oral assessments and cleanings using our evidence-based knowledge. And we also want to make sure that we are using open-ended questions during our conversation with our patient and also incorporate our reflective listening skills. It is very important to make the patient know that you are actively listening to them while having a conversation with them. And as dental hygienists, we are also in a great position to help prevent HPV and oral cancers associated with it. By educating about nutrition. So when it comes to nutrition, we want to educate our patients on the role that nutrition plays in health and development. It is really important to maintain a well-balanced diet to have a strong immune system to reduce the risk of contracting non-communicable diseases and protect our bodies against the human papillomavirus. So nutritional status has been recognized as a potential cofactor involved with the persistence and carcinogenesis of the human papillomavirus. So fruits and vegetables have long been known to be a good source of vitamins and minerals that keep our body in a healthy state. So there has also been some research done that shows that vitamin C, vitamin B12, and other specific carotenoids have protective effects against the persistence of the human papillomavirus. So overall nutrition can have a significant impact on the on our overall health, which is why we should be educating our patients on the importance of having a well-balanced diet that includes fruits and vegetables. We should also be providing our patients with educational materials, such as pamphlets with educational information about the human papillomavirus. Again, a big part of being a hygienist is to educate our patients with the ultimate goal of preventing disease. And the extraoral and intraoral exam is something that I really want to put emphasis on. We should really be taking the time to perform a thorough extra and intraoral exam on every patient to detect any abnormalities inside and outside the oral cavity, including oral cancers associated with the human papillomavirus. And, just by spending a few extra minutes with our patients completing the extraoral and intraoral exam, we can potentially be saving someone's life. So super important to take the time to perform the EOI exam. And catching these lesions early on is very important because the chance of a patient surviving an oral cancer is much higher when these lesions are detected in the early stages. So, and since the human papillomavirus is transmitted through skin-to-skin genital contact, we should educate our patients about the importance of limiting their sexual partners and practicing safe sex to reduce the possibilities of contracting the human papillomavirus. And, for some people, asking about sexual histories and number of sexual partners can be very awkward. So finding ways to incorporate it into the patient health history would be a good starting point into the conversation to make the conversation flow more easily. Next slide, please, Kat. So in conclusion, we want to educate our patients on the transmissibility of the human papillomavirus, and something that you always want to keep in mind is to never perform an extra oral exam without gloves, because I have personally seen it be done by a doctor. So, and the reason I say this is because if a person has a wart due to the HPV, by simply touching it, you can contract the virus. So always make sure that you glove up when doing your extra oral exams. And you also want to emphasize to your male patients that they are at a higher risk at a 4-to-1 ratio, which with the intent of creating awareness and emphasizing the importance of getting regular oral cancer screenings. And remember to keep an eye out for warts, which are indicative that the body cannot fight the human papillomavirus. And a type of wart that we want to keep an eye out for is the filiform wart or facial wart. And these warts are caused by the human papillomavirus and usually appear around a patient's eyes or lips. And we also want to be aware of any signs or symptoms that may indicate that human papillomavirus has progressed to oral cancer, such as a persistent sore throat, difficulty swallowing, non-healing ulcer, or a painless lump on the outside of the neck. Also keep in mind that the HPV may clear up on its own or may progress to oral cancer. And if HPV does progress to oral cancer, surgery or radiation therapy are needed to treat the cancer. Again, very important as hygienists to educate and promote awareness of the human papillomavirus and always perform an HPV screening on every patient, which is done during the extraoral and intraoral exam. And always remember that prevention is key. So educate, educate, educate. So we really wanted to put emphasis on the importance of performing an extraoral, intraoral exam on every patient to detect any signs and symptoms related to HPV or oral cancers. So Kat and I recorded a video demonstrating how to perform a thorough extraoral and intraoral exam. And we included a section on how to perform a self-assessment at home, which is highly recommended for everyone to do at least once a month. And this can be done at the comfort of your home. So we will now be playing the YouTube video for you guys.
Alex, we can't hear the video. I don't know if
Hey, Kat, I think the audio is...
How do I just clicked on the link. Oh, wait, can you tell me if you guys can hear it now? Do you hear anything?
no, not yet.
Not on my end, Kat.
Okay.
Let me try to make me presenter and...
I'll stop presenting and see if you can do it.
Hey guys, this is Alex Stone.
And Kat Coleman.
Can you guys hear that?
Yeah, we can hear that.
Yes.
Okay, let me present.
Thanks, Alex.
All right. Let me know when you guys can see my screen.
We can see it.
Okay. And can you guys see it enlarged?
Yes.
Okay. Hey guys, this is Alex Stone.
And Kat Coleman.
And today we'll be demonstrating how to do a thorough extraoral and intraoral exam. So before we begin with the extraoral and intraoral exam, a review of the patient's medical history should be completed. We want to make sure that we ask the patients any questions related to alcohol, tobacco use, and other recreational drugs, and ask about any signs and symptoms such as persistent ear pain, difficulty swallowing, persistent hoarseness, or any change in their voice, which could be indicative of a pathologic change going on. And so the purpose of this exam is to detect cancer in its early stages, or better yet, before it happens. And if we can catch cancer early on, the patient has a much better chance of getting cured and of living a normal life. And any patient of any age can develop oral cancer, but the highest risk patients are generally older and male. So you want to ask the patient if they are smokers or ex-smokers. Other risk factors include alcohol, poor diet, and previous head and neck cancers. And the human papillomavirus is also a risk factor, especially for tonsillar cancer. And again, you'll want to ask the patient about any unusual changes in their mouth and listen for unusual changes in their voice. And if it's usually people with laryngeal cancer that will experience a hoarseness or change in their voice, so you'll want to keep an eye out for any changes in their voice. And if your patient states that she has experienced a sudden change in their voice and does not improve within 2 weeks, we'll want to recommend that the patient see their healthcare provider right away. And you want to let the patient know that you'll be palpating their head, face, and neck to make sure there aren't any irregularities. What you don't want to do is to just start touching the patient without their permission or an explanation at least, because that's just kind of weird for the patient. So you want to give them a heads up and let them know what you'll be doing. You'll want to start off by examining the face. So I'll put some gloves on. So you want to start off by examining the face, head, and neck for any changes in color, contour, consistency, and function. You'll first want to look and then palpate. Again, you'll want to explain to the patient what you're doing and why you're doing so that patient feels involved during the extraoral, intraoral exam. So when doing the facial inspection, you want to see for any irregularities in pigmentation and premature wrinkling. This may signal sun damage and the risk of skin cancer. So you want to keep an eye out for any irregular pigmentation and premature wrinkling. So in this case, you want to use the ABCDE rule to assess for melanoma risk in pigmented lesions. The ABCDE rule stands for asymmetry, border irregularity, color variation, diameter, and evolution. So when you're assessing a possible melanoma lesion, you'll want to look at how symmetrical the lesion is. So usually melanomas are asymmetrical, meaning if you draw a line right through the middle of the lesion, the two halves will not match. So you'll also want to evaluate the borders of the lesion. Border irregularities such as notched or blurred edges can be indicative of a cancerous lesion. So you'll want to examine the color of the lesion as well and document it on the patient's chart. You'll then want to measure the lesion. So usually melanomas are often larger than 6 millimeters in diameter. And with the use of our probe, we can measure the patient's lesion and document our measurements in the patient's chart. So the last letter stands for evolution. And we want to continue to monitor the size, shape, and color of the lesion. Therefore, good documentation is very important. Good documentation is very important so that the next hygienist treating your patient can keep monitoring the lesion and have good baseline data to monitor any suspicious lesions from the previous visit. And for example, if a patient's facial mole measured 4 millimeters in diameter during the last visit and was documented properly, the new hygienist would then remeasure the mole and document and inform the doctor of any changes for a possible referral to the oral surgeon. So we'll start off with, you'll want to make sure that you examine the patient's eyes. So the patient's eyelids should be visually examined for any signs and symptoms of any filiform warts. So filiform warts have a very particular look to them and are very different from other warts. So you'll want to inspect the eyelids, have the patient close so that you can see the eyelid. So these warts vary in color and they can be brown, pink, or skin toned. So filiform warts are caused by the human papilloma virus, and they can also form around the patient's lips. So you will want to look out for these filiform warts on the patients who present with the human papilloma virus. And unfortunately, there is no, the human papilloma virus can be spread through contact. So you will want to make sure that you're always wearing gloves when palpating these warts to prevent spread of the virus. The sclera of the eye should be white, so any shade in yellow in the sclera can indicate jaundice, liver disease. So we will want to document any subconjunctival hemorrhages of the eye as well, which can be caused by increase in blood pressure or trauma to the eye. And the eye should be normally followed with your finger, and there should be no swelling or enlargement of the lacrimal gland. So you'll want to kind of have the patient follow your eye so that you can fully inspect the full eye to see for any subconjunctival hemorrhages and stuff like that. So once you have finished examining the patient's face and eyes, you will want to then have the patient lower the head so that the occipital nodes can be palpated. You'll want to apply firm pressure while moving your fingers in a circular motion to feel for any lumps or bumps. So you'll want to kind of inspect this area for any swollen lymph nodes in a circular motion. You will also want to take the time to inspect the back portion of their neck to see if they have any dark striations around their neck, which are called acanthosis nigricans. So these dark striations around the back portion of the neck can indicate that there's too much insulin in their blood, and it's often a sign of prediabetes. So you'll want to ask the patient if there's also a family history of diabetes, if they don't indicate that they're diabetic in their health history. And if you do find these dark striations in the back of their neck and the patient is not pre-diabetic or diabetic, You will want to explain your findings and its association with diabetes to the patient. You will also want to recommend that they see their primary care physician to get the further evaluated. And the submental nodes, once you have finished palpating the occipital nodes and inspecting the neck, you will want to begin to palpate the submental and submandibular lymph nodes, being sure to press firmly against bony structure in order to feel any detectable or enlarged nodes. If a lymph node is detected, it should be noted if it's hard, soft, movable, fixed, painless, or painful. So you'll kind of want to, like I said, kind of press against bony structure to feel for any swollen lymph nodes. And if you can kind of lower your chin down there. Good. Okay, and so lymph nodes should be able to move freely, and remember that it's a non-painful lymph nodes that can be concerning. So tender lymph nodes are usually related to infection that our body is fighting. So basically, anytime a pathogen enters our body, it has to go through our lymphatic nodes, which act as filters to trap infection. And once our body recognizes the pathogen as non-self, it starts to send all these blood cells to the area, fighting off the invading infection. So this is why our lymph nodes swell up. And the swelling of our lymph nodes is basically our body's natural response to illness or infection. So we definitely don't want to ignore any swollen lymph nodes when doing our examination. And for example, in the case of a periapical abscess infection, we will most often notice the swollen lymph nodes under the patient's jawbone. So we want to thoroughly palpate the submental and submandibular lymph nodes if the patient indicates that they have a tooth pain, for example, to know, to just kind of make sure that they don't have an active infection going on. And throughout the examination, you want to make sure that you're comparing the left and right side for any obvious asymmetries. So the sublingual and submandibular salivary glands, when you're inspecting them, you'll want to ask the patient to raise their tongue to the roof of their mouth while palpating. And again, you'll kind of want to go in a circular motion and kind of press, gently press against the structures here. Okay, everything looks good there. And the parotid gland. So when examining the parotid gland, you will want to ask the patient to clench so that the parotid gland can be easily palpated. The reason for asking the patient to clench is because when we clench our teeth, the masseter muscle contracts and is easily located. So it basically serves as a landmark since the parotid gland is best found right behind the masseter muscle and in front of the ear. So I'll have you go ahead and clench, Kat, and then you can kind of feel the masseter muscle contracting there. So it's right in between the masseter muscle and right in between the ear. So you can kind of feel it right here. Everything feels good. So once we have finished palpating the patient's parotid glands, we will then place our fingers on the temporal mandibular joint and ask the patient to open and close. We will want to check for any deviation of the jaw upon opening and closing, and check for crepitus as well. So Kat, I will have you open as big as you can. Any discomfort there?
No.
Okay, now slide your jaw to the left, to the right. Any discomfort there?
Nope.
So if the patient reports any discomfort or you feel clicking upon opening and closing, you will want to make sure that you're properly documenting your findings. And so once you're finished inspecting the TMJ, you'll want to check for the pre and post auricular nodes. When examining the pre and post auricular lymph nodes, you will want to thoroughly and gently palpate in front and behind the patient's ears. So when doing this, you want to compare the right and left side for any asymmetries. And since you're already inspecting the pre and post auricular lymph nodes, you will also inspect for the visible portions of the external auditory canal to check for any abnormalities. So you want to pick up the patient's hair and look for any abnormalities inside of the external auditory canal. So everything looks good there. So when you're doing the checking for the sternocleidomastoid muscle, you will want to have the patient turn to the side, and then you'll have them lower their chin. So you can see that the sternocleidomastoid muscle right here can protrude, and will be easily palpated. So while in this position, you will want to examine the anterior and the cervical chain of lymph nodes as well. So you'll want to start off by feeling, go ahead and turn a little bit to the side. Okay, so you'll kind of want to squeeze there and feel for any abnormalities. And you'll also want to feel, like I said, for the anterior and posterior cervical chain of lymph nodes. you want to kind of palpate this area as well. Okay. And while you're in this area, you also want to let the patient know that you'll be examining the supraclavicular lymph nodes. So you kind of want to inspect this area right here to check for any swollen lymph nodes as well. And the supraclavicular lymph nodes are located in each side superior to the clavicle and close to the sternoclavicular joint. So when palpating the supraclavicular nodes, you will want to place your fingers above the clavicle. So you'll first identify the clavicle, and then you'll place your fingers above the clavicle. Using firm pressure, you'll want to make circular movements around the supraclavicular area. Okay. And again, everything I'm doing, you want to do it bilaterally, so you want to do it on both sides just to make sure there's nothing irregular going on. And to examine the patient's thyroid gland, you will want to be standing behind the patient to start to gently palpate each side bidigitally. And you will want to slightly displace the trachea. So, okay. Move it to the left, move it to the side. And we want to be aware of any nodules or masses that shouldn't be there. So we will want to visually inspect the thyroid gland by standing in front of the patient and looking for any obvious enlargements of the thyroid gland. So you will also want to palpate the larynx for enlargement or immobility. You can have a small cup of water handy so that the patient can swallow, or you can just simply ask the patient to swallow normally so you can evaluate the larynx. The structure should be able to move freely up and down when the patient is swallowing. So I'll have you swallow, Kat. Okay, I can feel the larynx moving up and down there, so that's normal. This concludes the extra oral portion of the exam. Remember that if a lymph node is palpable or a gland is swollen for more than 2 weeks, an appropriate referral should be considered. And it is also important to encourage our patients to perform self-examinations in between dental recalls, as they know their body best. So we'll now move on to the intraoral. So I'll kind of lay Kat back a little bit, and we'll grab some instruments. So you want to have a mirror handy during this examination. You'll want to have some gauze handy as well.
And then at this time, you'd also remove any lipsticks, lip gloss, any lip piercings, any tongue piercings, or any type of removable dental appliances such as retainers, clear aligners, and partial and complete dentures so that we can fully assess the mouth and enhance Alex's visibility while he's assessing everything.
All right, so I'll kind of lay you back here. So I'll do this kind of standing up a little bit and try to put this closer. Sorry, we're trying to improvise here, so we'll try our best here. All right, so the reason for having them remove everything is because a patient might have a lip lesion that can be covered with lipstick. Another example would be if a patient has a lesion underneath their partial denture, and if it's not removed during the intraoral examination, the lesion will go unnoticed. So it's very important that we have them remove everything so we begin our examination. I'm actually going to lean Kat forward a little bit so that we can enhance the visibility for you guys. Okay. So once the patient has removed everything that might interfere with the examination, you will want to start off by examining the patient's lips, both open and closed. So I'll have you go ahead and open, Kat. Okay, everything looks normal there. Actually, picture up just a tad more, sorry. So you want to take a close look at the vermilion border of the lips and the labial commissures. The color of the lips vermilion should be uniform and pink, and the junction of the vermilion and the skin should be crisp, and there should not be any cracking of the labial commissures, which could indicate a candida or a bacterial infection. So you will want to inspect the lips for any filiform warts, again, which are commonly found in the lips and eyelids of patients with a human papillomavirus. So you want to visually inspect that and have them open as well so that you can look at any signs and symptoms of the filiform warts. You will then want to palpate the lips with your thumbs and your fingers. It is normal to feel anything for minor salivary glands. They should all be approximately the same size, and it is very common to see this class changes in the lips of sun-exposed adults in the form of actinic colitis. So with actinic colitis, the vermilion border becomes blurred and irregular defined. So with it also looks rough and scaly with red and white zones. So persistent ulceration may indicate a squamous cell carcinoma. So while we're evaluating the patient's lips, it is important to educate them about the importance of avoiding too much sun exposure and having regular skin examinations and using sunscreen, especially here in Arizona. Now, for the buccal mucosa, when examining it, you will want to retract the tissues and have the patient close halfway so that the tissue can easily be stretched out without hurting the patient. So open big, okay, and close halfway. All right. Right here. Okay. So some normal findings will be bilateral linea alba and the Stensen's parotid duct. You should feel some small and uniform salivary glands, which are normal. You will want to document any masses found on the buccal mucosa, which could indicate a salivary gland tumor or a lipoma. And while inspecting the buccal mucosa, if the mucosa is diffusely white, you will want to stretch out the cheeks out. Okay. You'll want to stretch it out. And if the white goes away, it is most likely leukoedema. Now, if you notice any lacy white lines that don't disappear when they are stretched out, it can be indicative of a lichen planus. So again, you will want to compare your right and left sides findings to ensure that there aren't any significant asymmetries. And when doing our extraoral and intraoral exam, we want to see any asymmetries. Asymmetries usually indicate a problem. So we want to keep an eye out again for any asymmetries. And next, you will want to evaluate the color and contour consistency and function of the alveolar process and the gingiva. So make sure to do thorough documentation of the alveolar process and the gingiva, as it will serve as a baseline data for future visits. So what you want to do is you want to feel around the gingiva and all of the alveolar process, both maxillary and mandibular. And when inspecting the gingiva of the alveolar process, you will notice the maxillary and mandibular frenums, which are developmental. You will want to inspect for any epulas, which are non-cancerous masses that grow around or even over the teeth, such as gingival fibromas, giant cell granulomas, or pyogenic granulomas, which are more frequently found in women due to hormone changes during pregnancy. And another thing that you want to be aware of are recent extraction sites, which could potentially lead to alveolar osteitis, which is a dental term for dry socket. This can happen if the patient is not taking good care of the extraction site and isn't following the dentist's post-operative instructions. So smoking, drinking out of straws, and vigorously brushing can all cause the blood clot to dislodge and cause alveolar osteitis, which is very painful, so I've heard. So you'll want to educate your patient if you see that they have a recent extraction about that. And now when examining the alveolar process, you will want to check for any unilateral alveolar process expansion, which can be caused by an odontogenic cyst or tumor. So again, when inspecting this area, you want to know any irregularities or the alveolar expanding, which again could be indicative of an odontogenic cyst or tumor. And for your denture patients, you will want to keep an eye out for any excessive ridge resorption or painful nodules called traumatic neuromas, which can be caused by partial dentures or full dentures that are constantly hitting on the alveolar crest. And so denture patients can also develop other type of lesions such as epulas fissuratum. And these are basically fissures caused by the edge of the denture on the patient's mucosa. And this is due to the denture being ill-fitting. And in this case, you will want to let your doctor know about your findings so that the patient's denture can be adjusted to relieve all that pressure that is hitting in one area and causing the epulis fissuratum. So again, on your dentulous patient, you'll want to evaluate this area, both maxillary and mandibular, to look out for any epulis fissuratum. And denture stomatitis is usually caused by a candida, which is a type of fungus. And the normal flora of a healthy mouth has candida. However, when there's an imbalance going on, the candida can grow out of control, which can result in a fungal infection, such as denture stomatitis. So you'll also want to keep an eye out for that on your denture patients. And this is usually a result of poor oral hygiene. So you'll want to educate your patients on the importance of brushing their denture every day with a soft bristle, soaking them overnight in a water cup with a denture cleansing agent such as polydent tabs. And you can just let them know that they can buy those tabs at Walmart or Walgreens. And a lot of denture patients are under the misconception that since they don't have any teeth, they don't have to take care of their mouth anymore, which is not true because there's still a lot of bacteria that can harbor underneath those dentures and cause all sorts of problems. So you want to educate your patients on that. And now the hard palate. So once you have finished inspecting the alveolar process and gingiva, you will want to go ahead and inspect the hard palate. So when inspecting the palate, you will want to rub your index finger all over the soft and hard palate. And a relatively common developmental finding that will be seen in the hard palate is torus palatinus. And now something to be aware of when visually inspecting and palpating the hard and soft palate are pleomorphic adenomas, which are most common salivary gland tumors. And a pleomorphic adenoma can be caused by smoking, which is basically causing abnormal cell growth in the salivary gland or duct. And patients who smoke will often present with nicotinic stomatitis, which appears as a red inflamed area in the palate, and with these kind of small looking red and white dots that are highly slightly bumped out. So the surface of a palate with nicotinic stomatitis will also usually feel rough rather than smooth. So again, you want to evaluate this area and make sure that the palate feels smooth rather than rough. And smoker's melanosis is also commonly seen on heavy smokers. So again, you'll ask your patient how often they smoke. And smoker's melanosis is basically a black to brown pigmentation that can be seen on the patient's palate, gums, inner lips, and other oral tissue. So again, once you're doing your intraoral exam, you want to look for any pigmentation. And the soft palate. So now to get a good view of the soft palate, uvula, and tonsillar pillars, you'll want to ask the patient to loudly say ah, and you'll want to use the end of your mirror, kind of like a tongue depressor. So you'll have the patient say ah, okay, everything looks normal. One more time, say ah, okay. And it is highly encouraged to palpate all around the soft palate and the tonsillar and uvular regions. However, a majority of the patient cannot tolerate palpation of those areas and their body immediately triggers their gag reflex. So you'll want to be quick and efficient when palpating those regions in your patient if your patient is a gagger. So you'll palpate all the back, soft palate, tonsillar pillars, and the uvular area. Again, be very careful to not go too back to trigger your patient's gag reflex. So lymphomas and squamous cell carcinomas are two of the most common malignancies of this area. So you will want to ask your patient if they have had any sudden or unexplained earaches, which could be associated with pharyngeal cancer. So you want to make sure that you ask those questions, or sometimes your patient might even tell you this when they come in. So now some really important signs and symptoms that may indicate that HPV has progressed to oral cancer include any swollen but painless tonsils, persistent sore throat, dysphagia or difficulty swallowing, and non-healing ulcers and a painless lump on the outside of the neck that has been there for more than 2 weeks. So you want to look out for all these signs and symptoms that could be indicative that the HPV has progressed. So for this reason, that EOIO exam is very important. If we catch these signs and symptoms that may be indicative that HPV has progressed to oral cancer early on, the patient has a higher chance of survival. So you want to make sure that you thoroughly do an EOIO. And I know that sometimes dental clinics can get super busy, and it's very easy for hygienists and dentists to perform the EOIO examination on their patients, but it only takes a couple extra minutes, and you might possibly be saving someone's life by performing the extraoral and intraoral exam. So make sure you take the time to perform this examination on every patient. So upon palpation of the tongue, you will want to use a sweeping motion with your index finger to palpate the base of the tongue behind the circumvallate papilla. And this is also a very sensitive area of the mouth that can easily trigger a gag reflex. So you want to be very gentle when palpating this area of the tongue. And to easily inspect the tongue, you will want to use a 2x2. So you'll first pass your index finger around the tongue to feel for any lumps or bumps. Hopefully you guys can see that. So you want to use a sweeping motion with your index finger, and you'll want to grab a 2x2 to firmly grasp the tongue. and to pull it forward to get a view of the dorsal tongue. Now, when inspecting the ventral and lateral borders of the tongue, you'll want to pay extra close attention because this is where more than half of oral cancers will present. So you want to really stretch out the tongue, the ventral surface, using a gauze to firmly grasp the tongue. Okay, everything looks good there. And you will also want to thoroughly palpate the tongue using your thumbs and index fingers to gently squeeze the tongue and pull forward to feel for any irregularities. So in patients who have had tongue piercings, you will usually feel a bump on the piercing area, which most likely is just scar tissue. So you want to have the patient stick their tongue out, and you will want to squeeze the tongue to feel for any abnormal lumps or bumps. Now, another common area for oral cancer is the floor of the mouth. So to inspect this area, you will want to ask the patient to lift their tongue to the roof of their mouth so you can easily inspect this area. So once they have put their tongue up, you will easily be able to inspect the ventral surface of the base of the tongue, sorry. So to finish inspecting the floor of the mouth, you will want to place your index finger intraorally in the floor of the mouth and place your other hand beneath the chin to feel for any lumps or bumps on the floor of the mouth, which can be swollen lymph nodes or salivary gland tumors. So you'll want to, as you're putting pressure on the floor of the mouth, you want to put a little bit of pressure underneath so you can feel for any bumps or lumps or bumps. And remember that oral cancer screening should be performed on every patient once a year. And remember to keep an eye out for any changes in contour, consistency, color, and function. So unfortunately, we currently do not have a bell scope that can be used as demonstration. So we will pan simulate how to use one using a mirror. So a bell scope is basically a handheld and wireless oral assessment tool that uses natural fluorescence to enhance the way we visualize oral mucosal abnormalities, including premalignant dysplasia and oral cancer, which may not be visible to the naked eye. And usually insurances do not cover bell scope screenings. However, some of the offices that I have worked in offer the bell scope screening for only $10 to $20. And this should be done yearly. So $10 to $20 a year is definitely worth every penny in my opinion. And so you'll first want to explain to the patient that the bell scope uses a fluorescent light that penetrates to the tissue and can show any abnormalities. And if there's any area that looks dark, we will want to press on the area to check if it blanches. So if the area blanches, that's a good sign. If it does not blanch, a picture of the suspicious lesion should be taken and referred out to the oral surgeon for further evaluation. And the bell scope is basically a fluorescent light, and you will want to make sure that you hover the fluorescent light all over the patient's mouth while physically inspecting and for any dark lesions. So the bell scope has a little see-through opening, and you will activate the bell scope by pressing on a button, and it will start emitting the fluorescence light. So you want to check every single inch of the mouth to evaluate for any suspicious areas. You want to have the patient stick their tongue out while you're doing this. You want to have move the tongue to inspect the lateral borders. Raise your tongue up. Okay, and so once you have completed the patient's extraoral and intraoral exam, we will want to take the time to educate our patients on the importance of performing a self-examination for oral cancers at home. So you will want to encourage your patient to do this at least once a month. You will want to start off by explaining to your patients that all they will need to do for this self-examination is, all they will need is just their fingers, a mirror, and a good light source to visually and physically inspect their head and neck. So you will want to inform them that during the self-assessment, they will be inspecting for any lumps, red or white patches, changes in color, texture, and other lingering ulcers or any other unusual oral manifestations of signs and symptoms. So I'll kind of demonstrate how to do the examination. We will want to wash your hands. So I will be gloving up.
Okay. So first, we're going to have the patient be keeping an eye out for any moles or any skin lesions that have changed in size, color, or consistency. So you're going to explain to the patient that turning their head to the side will help them identify any lumps, much easier since the skin stretches out when we turn sideways. Then we're going to want to tell the patient they want to palpate underneath their neck to check for any asymmetry and lumps, similar to what we do in the office. With the use of the thumbs and the index fingers, you'll be able to feel around and inside their lips to check for any lumps, bumps, or changes in texture. You will then want to use your thumb and index finger to feel the lingual and facial surface of the gums, looking for anything unusual while you're palpating. Then you will want to open your mouth and pull your cheeks away, one side at a time, to look for any white or red patches. You will also want to use your index finger to look for any ulcers, bumps, or tenderness in your cheeks. And you want to make sure you do this on both sides. Now, our tongue can be very helpful to locate any sores or ulcers in the mouth. So you can do a quick inspection with your tongue to feel for any soreness or tenderness. You will also want to gently stick out your tongue to look at the inside and the sides of your tongue. If you need a firm grasp, you can use a paper towel if it's slippy or slippery, too difficult to hold with just your fingers. And you're going to look at both sides of your tongue while grasping it with a paper towel. Then you will want to press your index finger on the floor of your mouth and the sides of your tongue to check for any lumps, bumps, or ulcers. To check the roof of your mouth, you will want to lift your head up and open your mouth wide to check the roof. You will also want to be looking out for any lumps or changes in texture or color. And finally, to check the back of your throat, you'll want to use the flashlight from your phone to say, ah. And while you're saying ah, you want to use a clean spoon to depress your tongue to check for any irregularities or swollen tonsils. So that concludes the self-examination for oral cancer demonstration. Just remember that we need to stress the importance of doing monthly self-examinations for oral cancers with every single one of our patients, and explain to our patients that it only takes 2 minutes of their life to do the self-exam, which could possibly save their life. We want to thank you guys so much for your time. We hope that you found this informative and can teach your patients the importance of getting their annual oral cancer screenings and also doing self-examination cancer screenings.
Thank you guys for watching.
Thank you.
All right, so
yeah, I'm gonna call it right now. I think I found the single biggest productivity hack of 2021. It's this Google Chrome.
We have just one more video for you guys. Thank you so much for your patience.
yeah, so we didn't have a Valscope to demonstrate to you guys how to perform a Valscope screening, and the demonstration with the mirror was pretty lame. So we added a short video demonstrating how to use the Valscope screening tool. So last little short video here for you guys. Thank you guys for staying and watching.
So Renee, she's my patient today. I'm going to ask you a few questions, okay? So, do you smoke?
Sorry, guys.
So Renee, she's my patient today. I'm going to ask you a few questions, okay? So, do you smoke at all? I do not. Okay. Do you drink alcohol? Socially. Oh, that's fun. Yeah. Okay. How about clenching or grinding your teeth? I do. Okay. So when you clench or grind your teeth, do you wear a night guard? Yes. Okay, perfect. So what I'm going to do is definitely check on inside your mouth to make sure you don't have those cheek bites, because constant cheek biting can cause change in the tissue. Change in the tissue can cause cancer in the future. Okay. But we always have to make sure that all the causes are taken away. So let's get started by doing the basics. Turn the lights on. I'll get some gloves on. She's got her protective glasses. Okay. So all I'm I'm going to start with her lips. Now she's got lipstick, so pretty good. Nice color. Thank you. Okay, so I'll ask you to open your mouth for me, please. Brilliant. I'll spread everything. I start looking on the teeth area and the gums. Looks beautiful. Now stick your tongue out for me. In a nice way. Okay. Take a little gauze to hold her tongue. Okay. Then I look at the side to make sure everything looks normal. Look over here. Looks beautiful. Oh, you've got lovely teeth. Thank you. Good. And then I do not see any cheek bites, which is beautiful. Then what I do is I'll say, stick your tongue out for me. And I'll say and go So with that, I'm looking at the back of the throat as well. I looked at the roof of your mouth, looked at the floor of your mouth, and I press to make sure that I don't feel any lumps and bumps. And looks lovely. Okay. Now we're going to start with the Bellscope. It does not take too long. It is $10 a year, which is worth every penny because you're checking everything and making sure everything looks good and clear. So what it is, it's a fluorescent light that shines in the mouth. It penetrates through the tissues and it can show us any abnormalities. If I see something dark, all I need to do is press the area just to make sure that it blanches. Blanches is good news. If it doesn't blanch, what we do is we take a picture of it and we send it to an oral surgeon. And they let us know whether it needs to be biopsied or, checked further. So let's get started. Okay, you've got your glasses on. I don't need my glasses because I'm looking through the light over here. Open for me, please. Now, it doesn't take too long. It just makes a noise. It blows a little bit of air. And all I see is beautiful green light in her mouth. You stick your tongue on the roof of your mouth, please. Thank you. And this is a common area where you'll see some dark shadows. But when I press on it, it is blanching, which is really good. Okay, now stick your tongue out all the way. And I'll press on it and say, and say, the side of the tongue, stick your tongue out. Again. There we go. Well done. Okay, so I will definitely show some pictures of what an abnormal area looks like, but that's it. Voila.
Thank you, Dr. Sharma, for the oral cancer screening. I feel relieved that it was negative. What age should we start doing this?
Well, the age is usually because now teens are sexually active and because of the HPV virus. I would say you even start as low as 13, but 16 and above is a wonderful age.
Have you ever found oral cancer during
Oh, yes. Oh, yes. My previous job, we had a patient walk in and she ate something and she said it felt a bit funny under her tongue. When I looked in there, it was way beyond. I looked at the Bellscope, it was fiery red. It was terrible. We rushed her to the oral surgeon. The oral surgeon rushed her to U of M. It was that bad.
So that's why it's important.
Very important. I have a history in my own family. My aunt, she used to chew tobacco. And she did complain to me once that since I was in dental school, she said that she had an ulcer. Checked on it, it looked a bit funny. I told her to get it checked with a dentist. The dentist said, oh, don't worry about it, it's healing, it'll heal. But it kept growing, and he kept saying, it'll heal. So then she ignored it till it was stage 3 oral cancer.
Wow.
She had to get her tongue removed, her upper jaw, lower jaw. She was very disfigured. They thought they got it off, they got her lymph nodes off, but sadly it came back again and she died. My friend's mother, same thing, she had an ill-fitting partial, kept causing trauma to the tongue, and it started a tongue cancer, it went to the floor of the mouth, to the lymph nodes, she died. So people, it's very, very, very important to get an oral cancer screening done. I mean, a lot of times you think you don't have it. I have a lot of patients that says, no, I don't want to do the Bellscope today, but it is important just for peace of mind to do it.
So make sure that you and your friends and family are getting an oral cancer screening every 6 months and using the Bellscope once a year.
Yeah. Well, if your dentist does not have one of the bell scopes, you're more than welcome to come to our office at Providence Dentistry and we will screen you.
Hopefully this segment was informative, and as always, if you
All right, guys. Well, this concludes our presentation. Thank you guys so much for taking the time to listen to our presentation, and hopefully you guys found our presentation fun and educational. So thank you.
And then if you guys don't mind, I did post the link in the chat again to do the post one. Please use the link that I just posted and not the first one, because we're just trying to keep the pre and post test separate. And then if you guys have any questions, please let us know. We appreciate your time so much. Ms. Otello?
Kat, can you post it again, please?
Yes, I will post it one more time.
And then when do you want me to stop recording?
We can stop recording now if nobody has any questions. If you do, we can just post them in the chat and talk about them. But yeah, now is fine.
Okay.
Thank you.